This symposium is important because residents and fellows need to learn to understand science. They need to learn to judge science. Science is an important part of medicine.
I think more individuals are doing research and more individuals are presenting their research. The example of today is the largest presentation that we've had at these poster sessions showing that research is increasing. Also, there's been more of a tendency to do translational research, that is, to look at the clinical interventions that are taking place rather than just following a few patients or looking at a few results. So it's gotten broader, it's gotten much more relevant.
Our research shows that in diabetic subjects, the pathway which possibly the brain controls the liver is impaired, and in future possibly if all the mechanics were understood, we may be able to come up with a possible new treatment.
Basically, when somebody experiences heart attack, the blood flow is cut off, so the cells undergo different type of cell death, and I'm interested to identify the factors that actually can block the cell death during this process. Hopefully one day we can use some medication to treat the patient during the time to block the cell death.
I took 2 national databases and looked at the rates of hospitalizations for people with HIV by race and gender, and found large disparities. Women were often hospitalized more, as were African Americans. I think documenting disparities in care is the first step in fixing those disparities, maybe changing the way that funds are allocated or increasing efforts to recruit people not in care.
Well, being a physician is a lifelong requirement, really, to ask questions and to keep learning. And the best way to keep learning is to be involved in investigation.
This year we have extraordinarily high quality in 3 totally separate arenas. So I've looked at very, very good presentations that represent work that's come out of labs. I've also seen very, very good epidemiologic presentations where people have worked with very large data sets in a very rigorous manner. And I'm also seeing research that's directly about patient care and as a result of work on patients.
We're looking at lung function in firefighters in New York City, where this institution is located, and we're looking at if there's any ways we can improve their health and prevent further disease. Hopefully with the research that I'm involved in can be used by the New York City to improve equipment and protocols for the firefighters that work in.
One of the problems we have is with resistant tuberculosis, and the current test we have takes weeks to find out the susceptibilities of the bug, so to find out how to kill the bug, and we need one that's faster. So I'm working on a faster test that can be used, an easier one that can be used in the middle of nowhere.
My project looked at the disparities that exist among patients that are referred to cardiac rehabilitation, and basically we looked at patients to see if they initiated cardiac rehabilitation once they were referred to the rehab center.
Last year we had 62 posters, this year we had over 90. That's a 50% increase. You get that on the stock market, you're a winner. So we are winners tonight.
It's a wonderful, wonderful event, and we're delighted at the level of penetration into the program and at the quality of the science. And we do especially appreciate the support financially from Dr. Scheuer, who has made available the money for the prizes and for the symposium.
We're very proud of our residents and fellows. I think this is a big success.